Now, remember the My Health records that were put into place last year? And a lot of people had their issues about the idea of these sort of online health records. Well, if you were somebody who didn't do it or somebody who had a bit of a nervousness about it, well, this is exactly what you feared was going to happen. Have a look. 37 data breaches involving the federal government's controversial digital health record system were reported last year, including one where the wrong parent was given access to a baby's My Health record. The annual report revealed the agency spent $3 million on travel as the chief executive and others spruiked the new health system. Country of 25 million, 37 people with either the wrong data or 37 attempts to try to hack into the data. Matt, does it change your opinion about online health records?
Well, 37 is probably not a huge number, but some people would say it's 37 too many. And there were two particularly concerning cases among them, Paul, where there's actually the suspicion of fraud, where people have actually looked at other people's documents. Of course, that was the big scare campaign around all of this. I actually don't have too much of a problem with this. I think that the benefits generally outweigh the negatives when it comes to this policy, but they want to tighten things up. They want that figure to be zero, because I think that really for people to have faith in a system like this, they want an absolute guarantee that no one's going to be snooping around in their medical files.
Yeah, Chris, I don't know whether you're bought into the system or not. Look, the idea of it makes sense to me, that you have this digital profile that means it's not a manila folder sitting behind the reception desk in one doctor's office. But what do you think of these breaches?
Yeah, look, I think, it's not a huge number, is it? But for $2 billion, you'd probably expect the answer to be zero in the first 12 months, particularly some, most of them might have been mistakes and, some confusion over similar Medicare, people sharing Medicare numbers and that sort of stuff within the family. But those couple that appear to be fraud, that's a little bit of a concern. I also think it's a concern that we've got this $2 billion system, and it appears that a whole lot of people have forgotten that it's even in place and are not able, are not getting online and actually accessing this stuff. I know that I'm not. I'd forgotten that the thing even existed until these stories started kicking around today. So we're kind of wondering, what's the $2 billion for?
A healthy man who can pass any cough test.
Yeah, that's right. Don't look up my records, Paul. Jeez.
See, Matt, you've got to love when you hang out on this show. This is the way we talk. We talk like we do off the air, on the air. And that's the fun of doing this little show.